here? Cool. And Bryce had already mentioned it, but I want to get in the habit of reminding everybody that if you don't want to be recorded, then now would be the time to turn off your video and your mic. But we have Brock Howell. He's the Executive Director of the Snohomish County Transportation Coalition, otherwise known as SNOTRAC. SNOTRAC coordinates communication and builds coalitions among transit agencies, human service providers, and other community partners to identify existing mobility gaps and opportunities for people with special transportation needs, whether it's because of physical ability, age, medical appointments, income, or even more generally to get to school or work, and with elected leaders and agency officials to find, fund, and implement solutions. SNOTRAC imagines a transportation system that meets the needs for all people while being affordable, efficient, and convenient. A former attorney, Brock joined SNOTRAC in April of this year and has worked in the public and nonprofit sectors of many land use and transportation issues for the last dozen years. And he's also a potential Rotarian. Let's all welcome Brock Howell.
Thank you. I'm going to share my screen. Oh, I'm disabled. Is there ability to allow me to share my screen? So, there we go. All right. So before I get going here, I should ask, actually, I built a slide deck. I don't know how much time I have to use to fill up the time. Stefan, maybe, how much time do I have?
You're going to have about half an hour.
Fantastic. Okay. So again, my name is Brock Howell. I'm Executive Director of the Snohomish County Transportation Coalition. I'm going to provide an overview of SNOTRAC. I have a feeling many of you are unfamiliar with SNOTRAC and some of our program work. And then at the end, I would love to figure out or hear from you transportation challenges in Arlington and how we can best serve Arlington. And so I'm going to go through. So as mentioned, our mission is to connect people and communities in Snohomish County with and beyond with safe and equitable transportation. And how we do that is by advocating for improvement to transportation service and solutions through community engagement, coordination of resources, and strategic partnerships. So we have a unique niche of working with other organizations to making sure that each of the mobility services that are provided are working well with one another and finding gaps and finding solutions to address those gaps. Our funding comes primarily through federal dollars through the Washington State Department of Transportation through what's called a consolidated grant. 20% of the funding comes through local matches and contributions of transit agencies and partners with SNOTRAC. So if you're curious like who we are and how we exist, this is our funding stream. And we're within the context of other mobility coalitions in the state and the region. So the Puget Sound Regional Council helps manage and coordinate each mobility coalition in the 4-county region for each county. And they set 3 goals for our work. And one is making sure that we put people first in providing high quality transportation services, no matter who that person is and their ability to get around. Making sure we do that efficiently. And then finally, trying to make sure that we improve if there's gaps of where people cannot get where they're needing to go, being able to move more people, get them where they need to go. So those are the 3 big goals that we work within to improve service here in the county and our connections to adjacent areas. Our partners, we have a lengthy list of partners and I'm kind of summarizing here. Our fiscal agent for the for the coalition is Workforce Snohomish. Our primary government and partners are transit agencies, as well as Snohomish County and the city of Everett, as well as the city of, we have other local representatives that serve on our executive committee who are not Everett, and that rotates over the years. There are many community-based mobility providers that we traditionally don't think of when we think of transportation. And that's a lot of the work that SNOTRAC does, is thinking about those services and how do we improve those services and coordinate them. And those are provided by community senior centers, the ARC of Snohomish County, Catholic Community Services, Volunteers of America. There's a whole set, and we try to help make sure that they have the resources they need for providing services to their priority populations. And then there are Medicaid funded transportation services, both on the private and nonprofit side, for making sure people can get health appointments that they need. And then just other human service agencies that may not have mobility related services, but need or really prioritize transportation as an important factor, that are partners of SNOTRAC. And that can be both public and nonprofit on that side. For helping to coordinate our partners and the services they provide, we do have meetings every 2 months, and then our executive committee meets every 2 months in the in-between months. So that's just like a general structure for making sure we're coordinating. And I would encourage anybody here, if you wanted to join our partners meetings, you're invited to do so. They are not restricted at all as to who can join. I'm going to go through a few projects here, not everything that we do, but just a few things. First, I want to touch on the COVID-19 impacts as they've impacted transportation services here in Snohomish County. I'll go over a 2019 Snohomish County Transportation Needs Assessment that we conducted. And then I think one effort that we're doing right now that is relevant to Arlington is our North Counties Transportation Coilition, and a study that we're doing for providing a new mobility service to connect Camino, Stanwood, and Smoky Point, as well as potentially Arlington. And so we just conducted a survey, and I can provide some of the survey results for that work. So on the slide for COVID-19, I'm just going to provide a kind of a narrative here of what the impact has been. Both Everett Transit and Community Transit, as well as transit agencies across the state and region, have been severely impacted by having both reduced ridership of people not going to work and the physical distancing requirements. The ridership is down 60 to 70% on fixed route and paratransit services, starting to climb back up as we move towards phase 3 of the State Safe Start plan, but it's still really low. And that's had a tremendous impact on the finances of all transit agencies. Community transit, it has been somewhat well positioned to be able to take the blow. They had a substantial financial reserve going into the pandemic, which they can use to continue to maintain service post-pandemic at current levels, but potentially will delay projects or expansions that they had planned to implement. Everett Transit has had impacts, has had financial difficulties prior to COVID-19, and so had already been considering potential mergers with community transit or other arrangements, or increasing their local sales tax to support their service. So they're going through a process to evaluate their future, considering the substantial drop in revenue. They addressed kind of the health impact by limiting the number of people on the bus, being willing to skip riders at stops if the bus was too full, highly suggesting, if not requiring, people to wear masks, and then putting up barriers between, kind of plexiglass barriers between the driver and the passengers. They also had stopped doing front door boarding. So they went fare free up through the middle of July, I believe. Skagit Transit is very similar to all that for folks who also may be using Skagit Transit. So all severe impact. Homage Transportation Services, or sorry, Homage Senior Services provides transportation for paratransit within Community Transit's service area. So they would also be providing paratransit services within Arlington. And they too so they continue to provide paratransit services during COVID-19, all phases, but saw a substantial reduction in the number of people riding it, partly driven by the fact that senior centers closed down, and therefore there's less scheduled trips. They have a secondary program, a transportation program called TAP, Transportation Assistance Program, and they really leaned into that program to provide food and prescription delivery to folks during the early phases of the pandemic, and they continue to do that until now. So that's been the impact on the kind of the transit and the paratransit side within the county. Obviously, you know traffic volumes have been reduced. They're starting to pick up on the freeways in terms of regular vehicular traffic. So there's the WashDOT has, I believe, something like a $3 to $5 billion revenue shortfall as a result of the reduction in the sales tax and other revenues. And that's going to potentially impact the delivery of transportation projects in Snohomish County, and will be up for broader discussion, I am sure, in the next state legislative session. So I'm going to jump to our transportation needs assessment. So in 2019, but part of what the mobility coalitions do in each county is do a survey on a regular basis to determine how needs might be changing. And so the last we did was I don't know why this is 2018, it's 2019 of the survey that we did, conducted by a consultant and with a sample size of 524 people. So I just wanted to go, I think this provides useful context of how people get around, especially in thinking about people with disabilities versus not disabilities, or who are in an underserved area in terms of transit service. So on the left side here are 3 bars that show that on the x-axis you can see is countywide served area and underserved area. So that's how much transit service is being provided. And the far left is just everywhere, and then there's where transit has decent service and then is underserviced. And for each one of those, the folks who are dependent on someone else or on transit is fairly small on a self-reported basis. But if we look at between those with disabilities and not disabilities, obviously people with disabilities have a really high dependency on either carpooling with somebody or using a transit service, whether it's paratransit or fixed route. And that's a big part of what we do, is making sure that we're providing that as a county, and all of our agencies are coordinating to make sure that everybody has a transportation option, so they're not stuck at home and not able to get where they need to go. So this is just another breakdown of that for folks who rely on someone else for transportation, or you see that there's people who are not independent or who are dependent on someone else have a difficulty in, I need to move something on my screen, who claim that they are dependent. About 45% are relying on other people to carpool them, and 52% are relying generally probably on either transit service. I'm gonna minimize something. There we go. For people with a disability, similarly, breakdown of you're going to be relying on others or using transit service. If you have no disability, generally don't have to rely on anybody else. That's primarily going to be somebody who can drive themselves, has access to a car. Now, looking at, for people who are dependent and are within a transit served area, you can see that they have somewhat greater flexibility of getting around. Their trip length, so this is showing the average trip length within a served area. Those folks are able to, there's more of them taking short trips, and then an underserved area, folks are probably not traveling as much, and therefore they have longer trips that they are taking. This is also an urban versus rural distinction, and this becomes a major issue in trying to provide, whether it's paratransit or a community-based service or fixed route service, it is much more difficult to provide those in areas that are rural. Just a blanket fact. I'm gonna skip. And then finally, I think this is my last slide on the transportation assessment. But again, just reiterating, like for folks who are dependent, you can see people who are independent, whether it's completely or somewhat independent. Most people can get where they want to go just by driving, and then there's few that are choosing by carpooling with other folks. Within people who are dependent, we have those folks are going to be much more reliant on transit or other ways of getting around. So figuring out their solution is key. Yeah, I have more. I'm going to skip these if that's all right with everybody, so I can get to the North Counties Transportation Coalition. So the North Counties Transportation Coalition is a project of the Stanwood Community and Senior Center as the lead organization, the Camino Center, and then the Camino Resource Center of Stanwood Camino, as well as the Island County Regional Transportation Organization, and Snow Track, and the Stillaguamish Tribe. There are additional partners, but those are the lead organizations. And the primary purpose is to figure out what are the mobility gaps within, from the Arlington to Camino region, and how can we find a solution to fill that gap. So we are currently doing a study to determine what is the gap and how can we provide a service collectively to fill that gap. And so we just completed, as of yesterday, I got the report of a survey of the community that identifies the gap and some answers regarding potential service. We are now under contract with another consultant who is an expert in analyzing transportation services to come up with a recommendation to how to operationalize this service to provide. So this map shows the general area, and I'm providing this one because it's a little bit clearer than the next maps I'm about to show on next slides. So within our study area, the respondents showed one of the questions we asked was, what would be your frequent, where would you like to go? Or what is your, what are the destinations that you most frequently go to? We have two subsets within group, which the next slide I think shows, which is those of everybody, and then those who are most likely to use some sort of transit or other mobility service. And the highest destination out of all of them, just given our geography of who we were asking, was Stanwood itself. And the most respondents were coming from Camino, although we did have respondents from Arlington and other areas as well. So the places that folks said that were most inaccessible for them, and this is within the subset of folks who were more likely to use transit, said that Everett and North Seattle were the places that were the least accessible for them to get to. And so that's an obvious gap that exists. This slide should have been a little bit earlier to explain this, but of our total population, 62% had identified barriers of some sort to get where they need to go, and 38% had said that they had no barriers. And generally that 38% within our survey were people who had a car and could drive. So the barriers that they identified, and this is the for everyone within our survey, the primary reason, primary thing that people felt like that was a barrier to them to get where they needed to go was not knowing someone to carpool with. But then again, 38% of people had no barrier whatsoever. And then from here, we can identify a few others, just like preferring not to drive and not having another alternative to driving. And then several options around transit of not having frequent enough service, not running when needed, not having bus transfers when sinking. So people were able to identify multiple options of what their barriers were. One thing I just wanted to flag, and I have a feeling this is going to be the case in Arlington and the surrounding area as well. We did ask car and transit questions potential of what barriers could be. And a lot of our responses were on Camino Island or in a rural area. And they reported that the walking condition was not great, probably primarily because they didn't have sidewalks. And this is always something that communities can work on, is improving the pedestrian experience as well as the bicycling experience for getting people where people want to go. We asked what would cause people to use a shuttle service more likely. So would cause them to more likely use a shuttle service. And so we are trying to figure out if one of our partners provided a new mobility service, such as a community shuttle, what were the attributes of that service that would make them more likely to use it? And this got to a few answers, which is providing it on a fixed route, the ability for people to pre-schedule when they got picked up, so that being able to know when the service was coming and going was a primary attribute for them. Making sure that the transit service isn't too far away, that they didn't have to walk too far, was another big element. So we're hoping to use this information to design the service to meet what the community needs. The primary destinations where people wanted to go based off the survey responses included kind of North Camino. The highest preferred destination was Stanwood. Again, a lot of residents were in Camino trying to get to Stanwood. And then going to Arlington and Smoky Point, so where 10 to 15% of folks wanted to get there. Of course, if the service is going to Smoky Point and Arlington, then hopefully folks from Arlington and Smoky Point can also go to Stanwood or to Camino. So I'm going to pause here, maybe if folks have any. Well, I just have one more slide, or two more slides. So let me wrap up the presentation and then start taking questions. So the final thing that I want to cover is our next steps for SnowTrack. And so we're in the process of doing a strategic plan for our next 5 years. And we're setting out 5 initiatives for our work. One is creating and coordinating mobility services, and I've highlighted one example of how we're doing that. 2 is improving education, outreach, and engagement, doing more presentations like this, but also making sure that the public has the resources they need to know, to plan their transportation trips. 3 is working with local governments to plan and design communities that are designed in such a way people can get where they need to go easily, including just being able to walk down to your corner store. Initiative 4, a lot of this, whether it's highway funding or transit funding, requires obviously funding to be able to support transportation services. So educating elected officials, agency officials on the needs of the county is critical. And finally, 5 is around emergency management. If we have another pandemic or if we have another landslide, being prepared for those situations is key. Our role is not emergency management itself. Our role is more of coordinating conversations and planning for emergency management. But that is a key thing that we've been doing around the pandemic, and we will continue to do for planning for the future. I do want to dig in a little bit on Initiative 1 because this is the bulk of our work. And so one of the things that we really want to make sure that we do is really plan for key issues around transportation, and things that pop out to me is thinking about transportation services in the Arlington area and having a geographic focus on that. And we're doing that with the North Counties Transportation Coilition. I continue to like to expand that to include Arlington. And then working with specific population focus areas. And so working in Arlington to, if there's identified groups, whether it's working with the tribes or coordinating how people get from the rural area into Arlington, or with food banks in Arlington, of just making sure people are have the transportation services that they need. And then you can see in strategy 1.3 of many of those same types of conversations happening. And so these will be broken up into work groups and developing action plans for each one of these within strategy 1.2 and 1.3. And I think there's a great role that the Arlington Rotary could have in helping us facilitate these conversations, or at least participating in them. So with that, that's the end of my presentation, and I am interested in questions. And I see that there's a couple of chats. I'm not sure if they are yet.
Hey, Brock, my name is John Mino, and what I was trying to find in there, maybe you mentioned this already, but are most people going to healthcare, or are they going shopping? What is the primary reason for the destination of their travel?
That's a really good question. So We do have some of that data from the surveys that we did. Obviously, the sample size are pretty small, and the one we did recently from the North Counties Transportation Coalition was really focused on the seniors, especially. So we have a really high population of that within our survey data. In general, 20% of trips are commute related to work and to school, or to work, sorry, and then a really high percent of AM trips during the school year are related to, I don't know the exact percentage, I would have to look it up, but it's extremely high, are related to getting kids to and from school, of parents doing drop-offs. And a significant amount of congestion on the road is related to that, surprisingly. So those are two examples within the target demographic of, people who have a disability or cannot drive for whatever reason. The primary trips that pop up are groceries and then medical trips. And then beyond that, having family visits and going to senior centers end up pretty high on that list too.
Question for you, Brock. A lot of the assisted living places and the senior center in Arlington, the Snohomish Senior Center, has transportation that they do provide. Was that factored in to your survey? Them providing transportation for the people that live there or go to the senior centers?
Yep, exactly. So the Snohomish tribe is a partner and provides actually a local match to our work. They've been severely impacted by COVID-19, of where a couple of their drivers were exposed to riders who tested positive, and so they ended up just shutting down their transportation service. And they're providing trips for methadone treatment, but that's it. Right now.
I was talking about the Snohomish Senior Center. It's unrelated to the tribe.
Oh, the senior center.
You do point out the confusion. Yeah. We're working on changing our name as we speak. So
yeah, we did request that the senior center send out our survey, but we didn't get. I'm not sure it got sent out by the senior center to respondents. I will say, yeah, in terms of that specific senior center. Other senior centers did send it out, and their top destination, in terms of destinations of the shuttle service that were listed by the respondents, number one was to business districts and to grocery stores. And then number two was to transit hubs or centers like Smoky Point, and then three was to senior centers. So that was the top three options that people picked as specific destinations. Yeah. I think there's a great opportunity for the new community shuttle services if it's funded for it to provide service both to all three of those things within the same fixed route. So I think that will be a doable option for sure.
Brock, Gene Chase here. I have a question for you on Everett Community Transit and Community Transit. Is there any push to realize that we really should meld those things together, like Metro and so on, having one transit thing, or is that still a Fiefton issue?
So Everett City Council is currently considering their options for a potential merger, or at least a different alignment of services that closer together. So that's under consideration by the city council right now. Ultimately, it's the city council's decision. There's a potential. There's a few hiccups. Obviously, some folks in Everett love their red and gray buses. of the branding and having the control of their own service. They also view Everett Transit as a different type of service of providing local service versus commuter service that community transit provides. So they're worried about the ideological difference between the transit agencies and how that would affect service. And then probably the biggest sticking point more than anything else is the sales tax difference. So community transit has a 0.12 sales tax, and the city of Everett has a 0.06. So that's a major difference. And I think the city of Everett, or city council members, are nervous about doubling the sales tax related to transit within their area.
Well, I've often wondered why the legislature that puts all this money out for transit in one form or another just didn't tell the boys, you go get together in the back room, you get your red wagon, the blue wagon, go play together.
Yeah, transit funding is a challenge. There's a lot of fiefdoms, a lot of different models of how funding models of how it's provided.
Thank you.
Yeah.
Any other questions for Brock? Very good. I forgot to do happy dollars, so let's end the meeting on a good note. Dave, Dad, what do you got?
Happy that Brad could join us. And as I said, I don't know if Lee Harmon heard this part, but when I talked to Don Richards about joining us today, to honor our 50th, he had to tell me a little bit more about the plane crash they were in on Lake Kavanaugh. So
it was an incident. It was an incident, not
incident. I'm happy that Lee and Don survived the incident.
It was a water landing, as Sully would say.
And everyone swam away healthy.
Yes, correct. And here's the prop that went through the float that caused the angst. There was no hassle. I knew there was no problem when I looked up on shore and Don had saved our picnic lunch and was munching on a sandwich while I'm floating in, trying to keep the airplane upright. Anyway, all's well. No problem. No hill for a stepper like Don.
All right, Joe.
Today's a happy day. Jacob is starting his first day at his first job. So